This is not scripted, like we haven't talked about this, but I've learned a lot of things, and I'm starting to see different things that you see that I would never see before. I wouldn't even think about.
A year ago, you would have been like, get out of here.
Yeah, just with that implant, just being part of, talking to the owner of the company, but you helping us out like with the designs, talking to their engineers. What I felt there was like, you're taking care of your patients. You want someone that actually cares for your patients.
It's a Supreme family. It's to see if you're gonna be
everything that you told me that Supreme was all about. It turned out to be true.
Where did that motivation come from?
The motivation?
What pushes you?
My parents.
Your parents?
Yeah, my parents. My parents for sure. My family,
Welcome back to Supreme Dental Podcast. My name is Frank Navarro. My wife and I are the owners at Supreme Dental Clinic. Listen, you can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. We also have a phone number and an email that you can contact us with. Any concerns, any questions you guys have, we have someone now who's going to be running everything, not just me. So they're going to be able to answer you right away, be able to answer the phone calls the moment you do it. We want to hear from you guys. But today we have Mr. Eliaz. How you doing?
I'm doing great, Frank. Thank you for having me today.
No problem. Thank you for being here.
Always.
I know you're still in shift, so
yeah. Yeah.
How's everything? How's everything been with all the conversion, all the different things that are here? We just had some holidays happen. I seen you dancing in Thriller.
Right. Yeah.
I'm very happy that you chose to be a dentist and not a dancer.
Yeah.
But yet again, you're in the back, so I didn't see much of it.
That's why I'm in the back. Yeah.
That's what I seen. Yeah.
Mm-hmm.
Superman video, you were in the back.
They got to be smart about that.
Okay. Yeah. You didn't want to outshine everybody else.
Right.
That's why I kind of notched it down a little bit. I didn't want to go over the top. But there's a question that my wife asked me not too long ago. And I ask it all the time. I always ask our patients, how did you hear about Supreme? And I always ask our patients, how has Supreme changed your life? Obviously, you guys, the assistants, the team, the receptionists, people behind the scenes, it could be agencies or people that we work with that run our social media, are part of the big change. And people mention you guys all the time. Each and every one of you guys has fans. And for everyone who's watching out there, thank you so much. You guys come in and you guys say, I've watched so many of your episodes. I love what you guys are doing. We really, really appreciate that. If you want to share with other patients, with other friends and family, we would really appreciate that. We're as transparent. And we have beautiful souls just like you now have a beautiful smile. But the question I want to give to you, that I want to ask you, obviously we're not actors and none of this is scripted.
Right.
You just asked me what are we going to talk about, and I said we're going to freestyle it. My wife wanted me to ask you, how did you hear about Supreme?
How did I hear about Supreme here in Los Algodones?
Yeah, and what made you come to Supreme? And how has Supreme changed your life?
The first time I heard about Supreme was actually working at another office. And another patient mentioned that he came here, right? He was looking around, right? And he was here and he liked the way everything worked. And that was the first time I've ever heard of Supreme. And then I talked to one of the assistants, and one of her family members actually works here as an assistant as well. That would be Angel. And that's when I first started researching about you guys. I looked you guys up on Google, on YouTube, Twitter.
You stalked us.
A little bit. Yeah, Facebook,
It
Instagram, just to see. Yeah, just to see what's the big noise, what's going around. And I didn't know any of the dentists. I always knew that they were always busy. They were always getting more experience. They were always developing techniques. And I decided that I felt strong as a dentist with the experience that I've had and the new ideas that I've had. And I knew from different people that you were all about pushing forward, right? And I've been other places where I pretty much bring ideas up to the table, and sometimes they just stay there as ideas on the table. And with you, it's been different. We bring them up to you and Aida, and you listen to us. You think about it, right? Because we're just dentists, and you guys are the business owners, and you see things that we don't see, right? Because we're just thinking about the clinical stuff, and it works, and you guys make it happen. The way it's changed to me personally, I think I've developed just great skills here with the on and on with the patients, pretty much with personality as well, to develop with them, have a better understanding of what they want, right? How they feel, right? Because sometimes we get caught up in the moment of we're just dentists and we don't realize that there are people that are coming from very far away that are saving up money to come down here. That's an investment for them, right? So sometimes we get caught up in that, and we have to take a step back and realize who they are, where they're from, why they're here, what they're looking for. As a clinician, I could honestly tell you that the time that I've been here has just been I've explored and exploded as a dentist. And that's not to brag or anything, but the things that I thought I could do, I'm doing them. And there's always, so we get, you always push me to one thing, right? And once we get there, we always have another thing in mind. And
there's always something else.
Yeah, and we just keep going forward, and we always, and we're bringing everybody along. It's not like just me or Luis. We're bringing everybody along. We're making sure that everybody's growing at the same pace as a team.
Welcome to Children's Dental Facts. Did you know that just brushing misses 40% of your teeth? Make sure you floss. And you heard it first at Supreme Dental Podcast. If you didn't know, well, now you know.
Tell me about your interview, because nobody knows about your interview. We're going behind the scenes right here. With patients, we ask them, where are you from? Tell me about you. Tell me. Now we're going to, patients want to know who Dr. Eliaz is. People that are coming in. What was your interview like? What did you think about your interview? Because you told me, I know what you thought about your interview, but our patients don't know about the interview. So what did you think after the interview?
After the interview or before the interview?
Both.
Or both?
Go for it.
I had no clue what to expect, right? I had no clue to expect, but I have been to different interviews before, and they're pretty much straightforward and lame, to be honest with you. Just what do you do? What can you do? And when can you start, right? And with you, it was a little bit, who are you? Where do you come from? What you're looking for? I felt more as of, are you going to fit into the team?
Right.
Are you going to fit into the culture? Not just get to work, right? Because what I felt there was like, you're taking care of your patients. You want someone that actually cares for your patients.
It's a supreme family. It's to see if you're going to have that connection with the family, because we've had doctors that came in with specialties and that they're bragging that that pretty much God went, here you go, earth, and within a week they're gone.
Right.
And I'm not saying they didn't have skill, but they didn't have the connection with my team and the culture. But keep on going.
And so I just it was through WhatsApp. It was through messages, yeah. And everything that you told me that Supreme was all about, it turned out to be true. Sometimes people say, oh, well, they hype up whatever. No, it's everything he said he had that was going on and that was going to happen. I'm living through that, and 100% real. Everything. I know. I was pretty impressed when I first got here. The first week was I took it slow. I just wanted to see how everything worked, who the people were, how the procedures went, how the system worked, right? And then the second week, that's when I got hands on, and it's been great ever since. And I just kept on growing, and we're just growing and growing and growing, and we're not stopping.
I remember you told me that you said it's too good to be true.
Right.
That it sounded too good to be true. And that the first week you're like, oh no, it's too good to be true. And the second week it was that again.
Yeah.
And then after that it's been like that since.
Yeah, then it's become normal.
It's normal. That's good.
Yeah.
That sets the bar high.
Yeah.
That's awesome. And tell me about how your life at Dr. Eliaz's life, how has it changed? How has it made a difference to be part of Supreme?
Personally, I view life a little different.
Okay.
Why? I was probably caught up on the moment where I was just a dentist. And now that I speak to people and you get to hear different people's stories and how the most of the patients that we see are elder patients, and they always go like, oh, my son, or you could be my grandson, and they start talking to you and they start giving you advice. And if you have any questions about what's going on, they probably they want to talk, right? And they want to listen to somebody. Like just 2 weeks ago, I saw one of Luis's patients, which we did together, and Joseph, and we talked about economics. You know, and when he came back for the second stage, he brought me a book, and he's like, hey, you know what? You're a smart kid. You're going to get somewhere in life. Because I told him that financially I had no clue what was going around the world. You know, there's a lot of things going around the world. He's like, hey, you know what? This book's going to help you out. And just little things like that you can get all kinds of ideas from different people that have lived different lives and that are different stages in life. And you can make better decisions through life with whatever the patients or even the assistants and other doctors. So it's been pretty good.
So you're in a completely different level now.
Yeah, I feel much different.
Well,
mature.
Hands-on, you've grown so much since you've been here.
Yeah.
Like it's been crazy. Like people, I always tell our team, we got to move forward no matter if we, walk, if we crawl, if we run, if we jog. You've been sprinting, from big trainings to, transnasal floor lifts to nasal floor lifts to pterygoids to, being able to, in the near future, obviously we have it already, but and you know about it, but being part of a design of an implant that was developed in Israel specifically for us, exclusively for us, being part of all that. It's a year ago, you would have been like, get out of here.
Yeah, just with that implant, just being part of, talking to the owner of the company, but you helping us out like with the designs, talking to their engineers, because it's one thing is us clinicians and one thing is them as what's possible, right?
Right.
And what we wanted and why we wanted it this way and why
what they could do.
Right. And why is it possible or not possible? And we had to come to like a middle ground, and it took some time. They did some prototypes. We didn't like them. We sent them back, and they redesigned it until we got to a certain point where, because of our experience and what we're looking for with this different design for a different type of implant, for the different bone that we're actually engaging, it's longer. The threads are different. The apex of the implant is different. They've also realized that the new design is actually stronger than what they've had. So it was a big learning experience, and it was kind of crazy to be, if you take me back a year and you tell me, hey, you know what, in a year you're going to be helping out, pick out a design for a new type of implant in the pterygoid region, where I thought a year ago, will I ever get to that point where I'm going to do those type of implants, But now being here with the support, with the experience, right, it's possible.
That's crazy.
Super crazy.
Where are you going to be in a year from now?
As I mentioned to you before, I'm going to be at the Supreme surgery room doing zygomatic implants for sure. Oof. That's the goal.
That's
the
big.
goal.
So mark it down, guys. Hopefully before a year.
Hopefully before a year. Yeah, that's the goal. That's the new goal. That's the new
Wow.
goal.
That's crazy.
Yeah. And we got to work. I mean, I got to work. I got to do I'm doing the research. I'm doing the learning. I'm doing the books. I'm doing everything. We're going to do the training. I have the experience. I have the backup, and it's totally possible.
One of the things that I always say, and not just to patients, is overall, because I have some friends. I have overall like one of my best friend and my sister, and I normally like to give some advice sometimes if I think that I could give advice. And I always talk about that I can teach only certain things, but I can't teach somebody how to motivate themselves, or how you can't teach somebody motivation. I feel like you can teach them anything else, but they're gonna if they don't want to do it, they're not gonna do it. No matter if they have the resources and they have everything in front of them, they're not gonna do it. And obviously, you have the motivation. Where did that motivation come from?
The motivation?
What pushes you?
My parents.
Your parents.
Yeah, my parents for sure. My family, growing up, I didn't have everything in life. I had everything that I needed to survive. I'm not saying I had a bad life or
Right.
anything. Even when I was going through dental school, my mom still cleaned houses so I could go through dental school. The crisis in 2008, I saw my dad lose his job. And even as a little kid, when we went to the U.S., and we had to come back, that was really tough for me.
Right.
So I'd realized that I had to get somewhere. Even as a kid, I was always like, hey, you know what? I need to do this. I need to do that. I have the best parents in the world. To be honest with you. It's not like I had a bad childhood, but it was kind of rough. It was kind of rough. But all their work and all their sacrifice that they put in their hands for me to actually be here, that's what still motivates me. That's where I get it from, my parents.
That just
the
makes
hard
you
work.
Keep on pushing.
Yeah.
When you walk out of here tired, and then you remember that they're tired was actually a lot different than you're tired.
Yeah.
Then you'd be like, yeah, because sometimes you send me a message and you're at the gym, which now happens rarely because it used to happen a lot more.
Yeah.
But I'd be like, how do you get energy? And you're always carrying, at some point you were always carrying around some book with you that I used to say was your coloring book.
Mm-hmm.
But it was your book on pterygoids, which then it was from Dan Holtzclaw.
Right.
Am I saying that right?
Yeah.
And that's the gentleman that you went to actually to Spain for training, and you actually got to meet him, and you talked to him, and you got a lot of pointers and things like that.
Yeah, a lot of the behind the scenes tips, right?
A lot of things change sometimes,
Mm-hmm.
But so your motivation, where do you see, like, obviously you're going to do, your next step is Sigomatics, and you push the team to the next level. The team looks up to you. The team looks at you and says, hey, you know what? You open up. There's several people in the team that open up at what they do. And you guys all learn from each other. And that's very hard to have in a team.
Yeah.
Because there's a lot of egos normally in a team. And I was asked a very hard question not too long ago, and they said, who's your lead doctor? And I was like, I don't have a lead doctor. All my doctors are leaders. Like, they lead in different things, but they all lead. I don't have a lead doctor. Like, I don't have like the captain of the team. Like, it doesn't work that way here. It's different. It maybe works different at a clinic that the owner is a dentist, because then the owner is going to go to all the trainings and take all that recognition. And here, you guys go to the training. You guys take on that recognition. We do the business side of it. And we're extremely happy with that, because I would not be able to do what you guys do. I wouldn't. I think it's awesome, but I guess everybody's born with different skill sets.
Right. And we just put it all together.
And everything just, it's like the perfect mix, But overall, what is your ambition? What is your goal? How old are you right now?
I'm 29.
29 years old. And you are a dentist specialist.
Right.
Where do you see yourself when you're 35?
35. I haven't looked that long at 35. Before I used to make that mistake. I'm gonna backtrack a little. Yeah. I used to think in 5 years, and sometimes when there was different options to go to different routes, I would really think about it because I would be setting up everything for 5 years, and if something better popped up, I would be like, should I really go that way when I have worked for just one way? And that, on a personal level, that was when I was going to do the maxillofacial surgery specialty. The first year I didn't get in. So I was like, hey, you know what? I'm going to do it the second year. I'm going to go next year. I'm going to do the exams and I'm going to go straight in. But that year I was like, hey, I'm going to go to Los Algodones. I'm going to work for a year because I have to work. And when I got here and I saw that I could do implants here and I could do full mouth rehabilitations and all that good stuff, I was like, where do I go? Do I go implants or do I go the maxillofacial surgery? So even through all dental school, I was always focused through that maxillofacial surgery. But when I got here, I thought, wow, that's going to be very different.
You're going to limit yourself.
Yeah. I didn't want to say it for all the maxillofacial surgeons out there. But
I can because I'm not a dentist, so it's okay.
But yeah, that's what I saw, that I was not going to have the ability to do crowns, veneers, all that good stuff, and implants, maybe just implants, but it for the market that we have here was going to limit me to a lot of things. So that's when it was a tough decision because I used to think in 5-10 years, and that's when I realized that I had to make short-term goals and not that long of a goals because it would mess up everything that I would have to go before. Hopefully by 35, I would definitely would like to start a family.
Okay.
I don't have a family yet. I don't think there's time for a family at this moment. I have to work. On a personal note, doctors and dentists, our schooling is a little bit longer. So we have to hold out for all those things for a couple of years. Hopefully by 35, I would think about having my own place, my own clinic, or my own, clinic pretty much here in Los Algodones.
That's good.
Yeah.
It's always good to be looking ahead and be looking at what to do.
Right.
That's great, man. That's great. Me, in 5 years, I don't know. In 5 years, there'll probably be a Supreme in multiple cities, or there'll be something else going on. Every day is something different, and we have so many things going on, and so many things, so many ideas that all of a sudden strike. And my wife is she's a huge supporter of what we do, and sometimes she has a crazy idea, sometimes I have a crazy idea, and so far crazy ideas have been good.
And that's the thing. As I've met you and Aida make a great team.
Thank you.
You're more outspoken. You're more of the hands-on, with us, right? And it is true. You do have a lot of ideas, and that's another thing. This is not scripted. Like, we haven't talked about this, but I've learned a lot of things, and I'm starting to see different things that you see that I would never see before. I wouldn't even think about. And you're like, hey, this, hey, that, hey, this, and I would go, wow. So just like nitpicking your brain is a totally different experience, and has
same thing here.
Yeah.
I mean, I'm looking into like the Patsy protocol and things like that. Why would I be looking at something that includes zygomatics and pterygoids and nasal floor lifts and all that stuff? Like, that's not something that I would look into. And it was super interesting. And we were looking like 2 weeks ago at a laptop,
right? And
you were showing me this, and that, and I was like, well, to me, it would be that the pterygoids would be there to stabilize. And you're like, that's right.
That's what the Patsy protocol is all about.
And we started talking about that, and I said, and I said, well, when I want to shut off a business, because sometimes, you think so much about business, this and that, and I just want to shut off, and I normally watch football or something to do with the Broncos, but they're not doing so good. So now I got to look into some dental stuff, and that's probably going to be becomes a hobby, right? And then it just flows differently.
And we were talking about the zygomatic implants, and you're like, hey, they're too long. They're like, don't they move? What about the pterygoids? Do they stabilize? And I was like, that's the whole thing about the PFAS and the. I was like, you brought it together, and that's the whole thing about Dan Holtzclaw and Juan Gonzalez, that the pterygoids are to stabilize those long zygomatic implants. And that was pretty cool how you just.
It just clicked, man.
It just got it together.
It was good. Well, you know what? Thank you so much for being here.
You're welcome.
This was something different, and we're gonna be doing this with different dentists.
Yeah, I was expecting something different.
I know you were.
Yeah.
But thank you so much for being here. Thank you so much, you guys, for actually listening to our podcast. Don't forget to like and subscribe. This is Dr. Eliaz, and we welcome you here at Supreme Dental Clinic. You guys have a good one.
Thank you, Frank.